Hi friends, this is my final presentation on lactation preparation for returning to work. If when you return to work, you are starting from a robust nursing relationship, the transition back to work can be smoother than if you wait to prepare at the last minute. A successful nursing relationship will depend on several factors, the biggest being maintaining your supply. Bonding with your baby and learning about their hunger cues, and when your body needs to release milk and how to express it can really alleviate some worry around returning to work. Knowing what you need and how to do it will be vital. You need to feed your baby, not your freezer. Yes, it can be comforting to have a huge backup stash. However, you only need around 1 ounce per hour that you're going to be away from your baby. If you're going to be away from your baby during the day, yes, you do want to have a small amount of milk on hand to ensure that your baby is fed. But learning how to use your pump before going back to work can aid in building a small stash to use. You can also use tools like a haka or other milk collectors while you're nursing to help establish some of that back stock of milk. You should be pumping every time your baby is being offered a bottle. This is generally every 2 hours, give or take, but you need to pump to stay comfortable and to maintain your body's supply. This will directly impact how much milk you can save for feeding your baby. If you understand how to pump, you can do it before you are in pain and leaking at work. Waiting for this to happen will not be conducive to your health or your milk supply in the long term. If you know how long your pump sessions need to be, you can inform your employer about the length and frequency of the breaks you will need to take to do so. Practicing at home will also help you explore your preferences in pump settings and how to stimulate a productive letdown. You'll also learn your preferences in milk collection between bags, bottles, or a combination of the two, and you'll learn your favorite way to store your express milk. When you learn your pump, you'll also learn what you like to have on hand when you use it. You might have a favorite pumping bra if your pump isn't already wearable. You might want to have a sterile gallon bag for storing your pump parts in between breaks. If you know you will have access to a refrigerator, you can decide whether you want to invest in a cooler or just a travel bag. You might also want to pack other items like a water bottle, snacks, or other reminders of your baby. Having clothes or blankets that smell like your baby can help stimulate the release of oxytocin, which is the hormone that allows your body to release milk for a letdown. Knowing when and where you're going to take your breaks ahead of time can help you do so in a timely manner. Knowing where you can safely store your milk and your pump parts can ensure that your expressed milk makes it home safely to your baby. Working out a schedule to your breaks, who will need to cover you, and if you'll still be responsible for things like phone calls or emails during your breaks. All of these things being sorted beforehand can help alleviate some tensions in the workplace. There are federal laws protecting nursing parents' rights around expressing their milk in the workplace. Your employer is obligated to provide you a reasonable amount of time to express milk for your child. Your employer is also obligated to provide you with a private space that is not a bathroom. If you are entirely relieved of your duties while you're expressing your milk, your employer doesn't have to pay you for that time. However, if you're still expected to do things like answer calls or emails while you take your breaks to pump, your employer is still obligated to pay you for that time. Your employer is not allowed to penalize you for utilizing these mandated breaks. The only time that these laws are not applicable is when you work for an employer that has less than 50 employees and the accommodations would cause them an undue hardship. Pace feeding should be a standard practice to every baby being offered a bottle. It doesn't matter what's in the bottle. Pace feeding will help combat nipple confusion and frustration when nursing directly from the parent. The nature of pace feeding stimulates the duration of a feed from the tap, and it also encourages baby to stop when they're full. Slowing down a bottle feed can also provide time for bonding between the grown-up feeding the baby and the baby. This process allows the baby to understand when they're full, and it prevents the baby from being overfed. Pace feeding looks like using a small 4-ounce bottle with a slow flow nipple. You want to hold your baby in a slightly upright position, supporting their neck and head. When your baby starts exhibiting hunger cues, you can touch the nipple of the bottle to their cheeks or lips to help encourage them to latch a deep, proper latch. You want to hold the bottle horizontal, parallel to the floor, and tip the bottle only enough to allow the milk in the bottle to cover the end of the nipple. This prevents air from going into your baby. You only want to allow the baby to suck for 20 to 30 seconds. This is usually 3 to 5 swallows. And then you want to tip the bottle back and encourage the baby to take a break. And then you will allow the baby to suck again, and this is the pattern you will continue until the baby starts pushing the bottle away to express that they're done. Quiet moments of connection can really foster your nursing relationship when there's a significant amount of time spent apart. The instances of snuggling and connecting with your nursing baby at your chest can feel that much sweeter when you relax with them at home after a long day spent with bottles and pumps. A nursing journey does not have to end when you return to work. You can't pour from an empty cup. Taking care of yourself is just as important as all of the other duties you will find for yourself as a fresh parent. Asking help when you need it is brave. Tending to your own mental health is necessary. Staying hydrated and nourished is mandatory. You have to take care of yourself, not only because your baby needs you, but because you are deserving of the time and the kind of care that you give to your baby. Thank you for watching my presentation on preparation for returning to work. I want to give a special thanks to my friend Valerie, who inspired me to do this project and continues to amaze me with her dedication to her family. And here's my list of references.